Excelente simposio, sin duda. Siempre quedan ahí cosas que comentar. Y bueno, vamos a continuar con una ponencia internacional. Y déjenme comentarles un aspecto muy interesante. No cabe duda que lo que más se aprecia y se mide en una persona es su sencillez, es sus ganas de compartir su conocimiento sin esperar con decoraciones, sino que sea una vida de entrega. El doctor Giampiero Garau, él es un investigador italiano, es un investigador que realmente me dio su currículum de una manera muy breve. Él es químico farmacobiólogo, tiene un doctorado en química estructural y es experto en los mecanismos productores de fisiopatología de muchas entidades. Pero en su haber, para que vean nada más el nivel del personaje, en su haber tiene el descubrimiento de los nuevos mecanismos de acción de los diuréticos tiacídicos y cómo modulan al sistema endocannabinoide. Otro gran descubrimiento que él tiene es haber descubierto al transportador membranal de la vitamina B6, el haber descrito la modulación del sistema endocannabinoide en el sistema nervioso central, el mecanismo de la resistencia del carbapenem y el mecanismo de transporte de la vitamina B12 en la sangre por una transcobalamina 2. O sea, nada más. ¿Sí? Nada más. Brevemente, nosotros leímos su trabajo el año pasado, bueno, a fines del año pasado, y nos llamó mucho la atención este nuevo mecanismo de acción de los diuréticos tiacídicos. Así que le escribí solicitando su paper, me contestó, aquí está, y después lo invitamos y dijo, sí voy. Y a través de los laboratorios Silanes, que también agradecemos mucho, se pudo hacer. Entonces, voy a ver si lo hago bien, Giampiero. I will do my best effort. In Italian, you know? Okay. Benvenuto, dottor Giampiero Garau. È per noi un grande onore averla qui. Ammiriamo professionalmente il suo lavoro e il suo straordinario impegno in la ciencia. I don't know if I say well. Okay. Dottor Giampiero, come on.
Bueno.
Okay. Good morning, everyone, and thank you, Martin, for the invitation and all members of the greater community. In fact, the focus, as Martin introduced before, is here expressing the light in science, the discovery of the systemic target of thiazide, at least. Okay. And here an overview of my talk. At the very beginning, I will tell you something how this discovery was performed, and has the name PPLD, so is the target of thiazide, the systemic target of thiazide belongs to the endocannabinoid system. We will move to how endocannabinoid system can modulate neurovascular system, And finally, we will together briefly give an overview of how this information can be helpful in treatment with chlorothiazide or eventually other thiazide for treatment of hypertension. Okay, I start this the seminar giving. I suggest you, if you don't know already, this paper, thiazide and thiazide diuretics, so a recently review of FRAVE and in juvenile hypertension. And here is the image that shows exactly how when hydrochlorothiazide and then chlorthalidone were introduced in clinic in the 60s, let us say, then in the 70s, the medical community could highlight the benefit of chlorthalidone in clinics. Then the discovery of what was known as the target of the thiazide till this next discovery was the target of the sodium chloride co-transporter in the loop diuretics system. And finally, chlorthalidone, now you know better than me, is one of the preferred first-line treatment for hypertension. And finally, I add simply to the image the discovery of the endocannabinoid system as target of this thiazide. So this is a general overview of what you know already in terms of chlorthalidone effect. So it's the first line, one of the first line agents in hypertension and heart failure. It lowers blood pressure and cardiovascular events. Then thiazide has a unique feature that is show an acute action on blood pressure and then chronic therapeutic effect that started after 2 or 3 weeks of treatment. Then thiazide-like diuretic are low acid with respect to hydrochlorothiazide, and a high dose can induce some metabolic issues that sometimes happens in some patients. What is important is that thiazide works only on a patient that has some problem in terms of health. So hypertension, for example, diabetics, or eventually obesity patients do not work with people that are normal, let us say, in terms of health. And another interesting aspect is the fact that sometimes can have different effect with respect to when they use it in the morning or at bedtime treatment. And I show you that this target explain can explain most of these unknown effects or known things related to this system. Okay, the classic target was the sodium chloride co-transporter in the distal tubule. Essentially, it's a transporter of ions, and thiazide block the passages of this of sodium, and this function of the sodium chloride transport is related to gentle sediment that induce hypertension and electrolytic imbalance. Okay, you know. Okay. The inhibition of this renal target produce natriuresis, reduce extracellular volume, and reduce cardiac output, so the classic effect of thiazide. But on the contrary, clortalidin has also other pleiotropic effect and systemic effect that this novel target explain. Okay. And this is, so the problem of discovery an extrarenal target started after 2000, let us say, and I suggest you, if you didn't know already, to read these two papers of Solomon and Hughes of the UK, and practically thiazide as an acute necrotic effect and the diuretic effect after a few weeks started to decrease the effect, but on the contrary, chronic effect, long-term effect remains and have most of the beneficial effect of thiazide. Okay, and this is the target. This is an overview of the finding. Okay, the target belongs to the endocannabinoid system and is the enzymes that from membrane hydrolyze these unique phospholipids that contain 3 fatty acids inserted in the membrane. All other phospholipids contain only 2 fatty acids inserted into the membrane. On the contrary, this NAPL, so N-acetyl phosphatidyletanolamide, contains 3 fatty acids. And this is very useful because destruction of these rigid lipids essentially help modulation of membranes. Okay, and this is exactly the first action of this target. The second thing is that we discovered in a previous works that this enzyme works only in the presence of bile acids that helps the enzyme to remain stable in the membrane, and clortalidin and other thiazide bind in the channel of this modular protein and allow a flux of water and ion through the channel. And the channel is functionally related to the passage of PLP, so the active form of vitamin B6, through the cells. And contemporarily, the enzyme produce active biotic lipid molecule, just like this one, and other unsaturated lipids that essentially have a general protective effect in our body. Okay, when we have neuroinflammation, cardiovascular injury, any process related to disease, the endocannabinoid system start to increase its tone. We have a hyper-expression of NAPL-PAD and cannabinoid receptor in general system, and this has a physiological protective effect of any stress that interacts tissue, heart, and vascular and neurovascular system. Okay, and the hypertensive effect of clortalidin depends exactly on the incorporation of more PLP inside cells, in particular in mitochondria and peroxisomes. Then it has beneficial effect of endocannabinoids, lipid signals, and finally it has direct, through the channel, a diuretic effect. Okay? Okay, this is not generated by IRT, but it's a structure from crystallography for structural biology, crystallography and cryo-electron microscopy. And so we can see how clortalidin interact directly in the channel. The channel is this one. Thiazide bind exactly in the middle of the dimer and stress the association of the 2 monomer in the dimeric quaternary structure. Bile acid help the protein to interact with the membrane bilayer. And here in red is the nipple. I show you with 3 lipids inserted in the membrane, and bile acid and thiazide on the opposite of bile acids support the action of or natural action of bile acid to stabilize the protein and this is the effect we can see directly using this chlortalidone and other thiazide. So a direct diuretic effect, a process related to membrane fluidity, and so rigidity of the vascular system, increase the endocannabinoid protective role, and signaling directly, and then protective effects of PLP. Okay. When we have a dysfunction of the protein, what happens? It's genetically related to obesity. This is very important because its link has most of the, or some of the seminar during this convention are related directly to pathology, not only on hypertension, but hypertension is related to diabetes, for example, and obesity. Dysfunction generate cardiovascular and metabolic disorder. And finally, dysfunction of the neural system. Here is an overview of where exactly this target is expressed, mostly in the brain, and it modulates essentially the vascular and neurovascular system in the brain. It's expressed in the gut, and bile acids in the enteropathic circulation activate physiologically the protein. The brain is also the unique, the unique tissue in which we can produce bile acid other than liver. And it's also highly expressed in the heart and in the urogenital system. Okay, and here is most of the receptors that are target directly by the endocannabinoids. So cannabinoid receptor number 1, cannabinoid receptor number 2, and TRPV1 that is the capsaicin related receptor that mediates essentially that block essentially the pain sensation, and also is a thermal receptor. And capsaicin is something that you eat daily with spiling, activate immediately these receptors. Okay, and the neurovascular units control directly using neurons and the perivascular muscular, the resistance of as you know, or resistance. And then another aspect to consider is that bile acids are modulated by microbiota that convert essentially primary bile acids to secondary bile acids, and alteration of microbiota is known to be related directly to the endocannabinoid tone. Okay? This is again an overview of what the activation of this receptor, in particular CB1 and CB2. CB1 is mostly related to modulation of the neural system. In the central nervous system, CB2 receptor exactly is our GCPR receptor that blocks inflammation in all body, and in particular in the peripheral nervous system. And there are other receptors that essentially give all neurovascular pervasive system, as I suggest before. Most of the effect are direct anti-inflammatory agents, anti-inflammatory actions. Okay. Here is 3 examples of product of this enzyme in membranes. So the most famous is anandamide that acts directly of cannabinoid receptors and is a partial agonist and does not give a psychotic effect because the most important agonist of the cannabinoid receptor is the TCC of marijuana, okay? But it does not produce adverse effect. On the contrary, endocannabinoid system are soft carries GCPR receptor and have a smooth regulation of these receptors and give essentially afferent arterial vasodilation, particularly with direct some modulation of the vascular resistance and directly with the cannabinoid receptor activation. The second is norepinephrine release for the sympathetic nerves, and another is activation of a calcium receptor that give dilatation bruxisms and that are expressed mainly in cardiovascular and renal system. And CB2 receptor is, as I told you before, a blocker of inflammation and protect tissue and from oxidative stress. Okay. OA is another product of this enzyme and has GLP-1 like effect in our system. And why endocannabinoids is very important and the discovery of bile acid that modulate this system? Because endocannabinoid system, when we eat something related to fat, let us say, okay, start to increase the level in the entire body to allow, above all the system to incorporate lipids that are very, very helpful, above all, in particular in the development of the, in protection of the central nervous system and peripheral nervous. In the absence of this protection system, endocannabinoids cannot perform exactly their protective effect in general. And finally, I would like to highlight also the use of PIA. That is the only, let us say, compound still in the market that can be used as a nutraceutical. It's very famous, and it has very strong protective effect, analgesic and anti-inflammatory effect as a nutraceutical, and it's well known to attenuate arteriosclerosis process, arteriosclerotic process. Okay. Let's move. A big step to conclude overall system that is quite complex, but is easy to visualize. Okay, as endocannabinoid systems, so NAS signaling is related to the modulation of bile acids. The two signaling system, biological signaling system, are strongly correlated. As I told you, as I suggest you with respect to what we eat, and the level of bile acid directly activate the endocannabinoid system to protect our body. Okay, and another thing that I also indicate before is the fact that when an APPLD is in the membrane, it performs the activation of the lipid signaling thanks to the help of bile acids, and this is helpful to introduce in mitochondria and peroxisome the active form of vitamin B12, B6. Most of the 100 enzymes in our body depends structurally from this cofactor. In the absence of this cofactor, the neurotransmission can occur, and also the metabolism of amino acids and fatty acids are related to this cofactor in our body. Okay, and these two are two examples of what are the effect of introducing more active form of vitamin B6 in our body. So it protects for the ischemic heart disease and also has protective effect on the renal. And this is an overview of what how the system is complex and anyhow how the thiazide can influence directly the entire system to protect ourselves from hypertension and correlated comorbidities. Okay, to conclude, I just suggest the unique action of bile acid in parallel with clothalidone, and it's helpful because endocannabinoid system produce analgesic effect similar to what GLP-1 agonists induce. The importance of hypertension and comorbidities is related to microbiota, and microbiota modulate bile acid directly. Okay. Okay, that's already done. I'm going to finish. What is important is the expression of the protein during our life. At the very beginning, the expression of NAPPLD increased strongly, continuously in parallel to neurovascular and systemic neurovascular system. When we arrive at about 40, 50, unfortunately, the enzyme, the expression of the enzyme is finished, start to have a plateau. And exactly at this point, thiazide, and in particular clothalidone, help this enzyme to maintain protection during when our age goes on. Another important aspect is this one. All critics, all ill patients have imbalance of bile acids, and this is an important aspect to consider when we need to treat hypertension and comorbidity. And another aspect is that the daily, the chronological variation of levels of bile acid strongly influence the effect of thiazide. Okay, can have effect on thiazide, and this is why this explained why morning and midnight treatment can have different effect in different patients. Okay, to conclude, okay, Larry Barton scribed me an email that he read our paper, and he told us that the discovery will be in the next book of the pharmacological basis of therapy that at least in Italy all medicine and pharmacologists use for improve the knowledge in drugs, and Iscribe also. It's a wonderful science continues to surprise us. And this is an example of the system. And if you would like to read something about this story, is in American Journal of Hypertension a review about this discovery. Okay, we conclude. The acute and chronic effect of clothalidone is related to the targeting of the NAPPLD enzyme of the endocannabinoid system. It has a mild diuretic effect, you know, and above all, it has a vascular relaxing agent, and also it has strong neurovascular protective effect. And this is a feature that distinguishes clothalidone and other thiazide with respect to other first-line agents. Another aspect is you know, that is helpful in resistant and variable hypertension comorbidity. And here is an overview of the main action of clortalidone. Conclusion, okay. The activation of the endocannabinoid system activates directly bioactive lipid signal on membrane. They have also direct action of several GCPR receptor and other receptor that help the protection effect physiologically. Another aspect unit of these drugs is that they support in disease the requirement of PLP in our cells for protection. Another aspect is the chronobiology of bile acid system. This is I don't know, but if you would like to discuss, we can. If clortalidone can be still be considered as only a diuretic, but it has also several other protective effects that no other drugs have. The future will be probably the use or the modulation of this system on other neurovascular pathologies, in particular neuropathy, white matter disease progression that is unique, and there is no drugs effective on this particular process of disease that is related essentially to dysfunction of the neurovascular system. And finally, dementia that is strongly related to the protection of the neurovascular system itself. I don't know if actual thiazide can have this effect, but eventually you will tell me about. That's it. Okay, acknowledgements. The group at Laboratorio Oliveda, the Italian Institute of Technology, in particular my postdoc Sara Chiaruggi and Francesco Margheriti, and the University of Pisa and University of Milano. And thank you all of you.
Muchísimas gracias, doctor. Quienes hemos tenido oportunidad de hacer presentaciones en otro idioma y en otro país, entendemos lo que es esto, ¿sí? Y bueno, ahorita vamos a tener vamos a pasar a un conversatorio donde vamos a tener oportunidad de escuchar al doctor Giampiero. Y a mí lo que me deja muy claro es cómo uno establece ciertos mecanismos de acción de medicamentos y ya, ¿no? Este medicamento es así, y así nos lo enseñaron, y ya. Han pasado 60 años del descubrimiento de estos medicamentos diuréticos, más de 60 años, y resulta que se descubren nuevos mecanismos de acción que para mí la trascendencia del descubrimiento de estos nuevos mecanismos de acción es que conectan muchas explicaciones que teníamos nosotros. Es decir, no solamente son reductores de volumen, no solamente actúan sobre el balance sodio y electrolitos, sino que también tienen otros mecanismos de acción que participan en la modulación de lo que tiene que ver con los aspectos neuronales, y entonces uno comienza a pensar acerca de los mecanismos de producción de demencia, en donde uno ha dicho, bueno, pues es que les da aterosclerosis cerebral y isquemias y microinfartos, etcétera, y resulta que pueden ser otros los mecanismos productores de estas alteraciones, y que el impacto que pueden tener este tipo de terapias, como ahora lo van a explorar, pues abren todo un nuevo panorama de estudio de cómo los mecanismos de acción van más allá de los aspectos de depresión de volumen o de regulación del sodio, sino que tienen que ver con aspectos, bueno, hasta con la microbiota, pues. Aspectos neuronales, aspectos vasculares, neuroinflamatorios, inflamación, etcétera, etcétera, etcétera. Entonces creo que es muy interesante lo que nos viene a aportar el grupo del doctor Giampiero, porque independientemente de todo nos habla también del efecto de clortalidona como el medicamento con una estabilidad mayor porque su vida media es más prolongada, y ahora entendemos por qué es un medicamento que se puede utilizar para la variabilidad de la presión arterial por estos efectos vasodilatadores estables que tienen estos medicamentos. En fin, todavía hay muchas preguntas que responder y sin más, quisiéramos, si me lo permiten, pasar al siguiente módulo para aprovechar al doctor Giampiero, o si alguien tuviera alguna pregunta o comentario, la doctora Silvia quiere comentarle algo al doctor Giampiero. If you can speak in English better. Thank you.
Thank you very much, Dr. Giampiero, for your excellent presentation. And I am very pleased to see that you're a very young man. And you have given to us, well, I don't know, but you look very young. But actually, you mentioned one important aspect in renal physiology that it's very interesting in all the context of the cardiometabolic syndrome. And this is the point that I would like to ask you. You didn't mention, or you mentioned very slightly, about the renal mechanism of chlorthalidone. But this is very important because the kidney also suffers those systemic effects on vasodilatation, and the inhibition of the sympathetic nervous system is something very amazing. This mechanism is very important in the initiation and progression of kidney damage. So your contribution is very, very good. So thank you very much for your talk. I'm pretty sure that all of us are going to read you very intensively. And I hope you will have some information about this in the future. Well, if you let me ask a question in this moment.
Yes.
Do you have any information about the effects of the cannabinoids via into the kidney? Do you have any information that you can share with us?
Okay, in the protection you mean, or
Yes.
in the general?
No,
Okay.
in general, well, no.
Well,
I'm not going to be ambitious today.
I've not more the presentation. Okay. Well, okay. One of the main side tissue in which this target is expressed is, brain for sure, above all during development of the brain vascular connection, but in the gut, the kidney and urogenital tissue are other point in which the NaPi-PLD is expressed highly during the entire life till, let us say, 40, let us say, in terms of age. And possibly the inability of the endocannabinoid system to respond rapidly to alteration of the to inflammatory states, let us say, is what during times contribute to damage directly in this tissue. Okay. That's the main.
Oh, no, thank you. Thank you very much. Thank you very much. We're going to read your papers very, very carefully. Thank you,
Sí.
Dr. Giampiero.
Ok, gracias, doctor Giampiero. La aportación importante de la doctora Silvia dice, bueno, pues es que esto abre un mundo muy importante en el estudio también de la fisiopatología de enfermedad renal, y bueno, estos descubrimientos tienen algo más que aportar. Pero bueno, se les ha repartido algunas carpetitas donde vienen algunas hojas, viene nuestro consenso y viene también en la guía Pocket y ahí viene para cómo entrar al trabajo del doctor Giampiero. Entonces, nuevamente, doctor Giampiero, thank you very much. You stay there. We are going to continue and maybe we have a lot of questions for you. Okay, thank you very much.